Jacob, is healthcare in Cuba publicly funded? Or do they have a model or equivalent of a mongrel we call SHA? Because I think, in my opinion, if we can graduate our healthcare to publicly funded health system, we might be able now to standardize in a manner that now you don't have to labor the numbers for you to get compensation as a facility. But I don't know if you have reference from Cuba or any other country.
I have quite a number of references that I can make. One, we have Thailand, which for me is one of the best universal health coverage formulas in the world. In fact, the best in the world. We have Rwanda. I know it's quite an autocracy, but its health systems are working. Of course, Cuba is one of the most beautiful ones because of their doctor to patient ratio, which is very beautiful. Because in Cuba, I think it's 1 doctor to 1,000 patients, or 10,000, something like that.
Where are we in Kenya today?
Kenya,
roughly
17,000. 17,000 to one healthcare practitioner.
Hey,
actually, one healthcare practitioner, not even one doctor.
Yeah. Wow.
Yeah. And in Kenya, we are graduating about 7,000 healthcare practitioners every year, against the demand of 70,000 every year. Okay. Now, set that aside.
Right.
The biggest question that then comes in is this. When we're talking about promoting healthcare at the level that everybody feels it, we first talk about the affordability. We hold medical camps, a lot of them. I can tell you, so many people who show up at the medical camps, they are struggling with one question: affordability. Because even under SHA today, you still have to give something. Apart from the cover that is given. And that's a concern. If you go the Thailand way, and that's what we've advocated for, and just allow me to say it, because the moment we start getting tired is the moment they start listening, that we must levy high-risk consumables, so that high-risk consumables fund our healthcare. I don't know, Ms. Keller must have done the calculation on how much we need to fund our healthcare end to end. If we, for example, levy just a shilling on bread per day, bread is a high-risk consumable. The public may not want to have that discussion, but it's a necessary discussion. Alcohol is high-risk consumable. Processed sugar is high-risk consumable. Tobacco. And so many more. Soda. In fact, soda is a useless thing. Soda is one of the most useless things that people take. You take a lot of soda, it does not add any nutrition to your body. It only promotes insulin resistance.
It's nice.
In your body. It tastes nice, yeah? But it is affecting you badly. Today, 60% of chronic kidney diseases, I can tell you, is a result of mismanaged diabetes. Okay?
Sugars, yes.
Yes. Mismanaged diabetes treatment. And it accelerates further and leaves you at cancers, leaves you at, I don't know, they call it diabetes foot or something. There's so much that comes with it. Now, the moment we're not talking about affordability, we are not starting to talk. And counties cannot handle the question of affordability.
What does that mean?
They can't handle financing of health in terms of generating money that can assure every citizen and resident of the county that you can walk into a hospital and get treated. Counties cannot do that function.
Can't or won't?
Cannot, will not.
In fact, the worst part of it, I hate to interrupt you,
Yes,
is that they're not just inputting money.
Yeah.
It's a scandalous what the countries are now doing. Countries are now dipping into the... You see, the SHA came and said that they reimburse facilities.
Yes.
Yeah.
Money is sent to bank account to the... Now counties, when they hear that SHA is reimbursed, the governor comes for his cut, and they come for it in cash.
Cut of what?
Whatever SHA given.
How does he have a cut?
Scandal the other day in one of the South Rift country, where we were lacking drugs, labs were shutting down, SHA delayed to reimburse. Then the money came like this. The first person who came for this share was the governor. Came akachukua yake. Mnaambiwa ile imebaki mjipange nayo. It's madness.
But that's a criminality.
It is.
Yes,
How
it's
do you have a cut?
leadership and governance issues.
How do you have a cut of money that's supposed to go towards paying facilities for services that have been rendered to patients in the country?
Because the challenge in this country is we have a question of eating.
Yes.
The eating question is a big problem in this county. In this country, there are several counties which, of course, are doing exemplary well in terms of medical whatever. They're doing exemplary well. As much as we would like even to bash, let me just rebut on this. We would like even to bash Kakamega County for that 10 billion thing. I would go again to the specific leader who was there then, who was Oparanya, and I'm not afraid to say it, that when he invested that amount of money into that level 6, he was hoodwinking the Kakamega residents. Because why should you start building a hospital which is not going to finish? Now, when the new governor comes in, he finds, There are so many pending bills here. I cannot even finish constructing this thing. So what do? The governor now, Barasa, hands it over to the national government. Says, you know what? Anyway, level 6 is under the national government. Chukweni hii kitu, mumalize. Okay?
Yeah.
So yes, there's that, which is bad. The biggest question is the extraction mentality that we're having as politicians in this country. We wonder when we go to counties, we don't go there to lead those people. Because look, it is sensible to do that. If you look at yourself, in 40 years from today, God willing, all of us remain alive, and you are retired, and you've gone back home, and you have a heart attack, okay? I know it takes between 5 to 7 minutes for you to be saved. Today, if I go to Kabondo, where I come from, okay, and I suffer a heart attack, I'm slim, yes, but I can have a heart attack. There is no ambulance which will respond in 5 to 7 minutes. Because those ambulances are not there. But how much is an ambulance? Equipping an ambulance?
But
it's so cheap.
When you are about 40 years, when even right now, if you think you're a middle class, you're a governor, you don't care about public health care. You take your family to Masai Mara to see the immigration, you get a road accident. Will you be saved where you'll go to? No. Or you go snake bite you and doing in the village? Can you be saved?
But they are lifted. They are lifted to...
the extraction mentality.
A governor for Meru, the former governor said that they want an airport in Meru to be able to lift them when they have political emergencies.
So